He who has health has hope. He who has hope has everything. But the COVID-19 pandemic has not only challenged our health but also hope in the last 2.5 years. Exactly 2 years ago on this day, India reported its first COVID case when a female medical student returning from Wuhan tested positive. Since then, the virus has posed innumerable challenges to the livelihood, health, etc. So today, let's talk about the less talked yet crucial impact of the pandemic and start our today's dialogue on COVID-19, an unforeseen worldwide challenge to mental health. COVID-19, a respiratory disease caused by SARS-CoV-2, which started off as an endemic in Wuhan, China, became a pandemic, creating an unprecedented situation worldwide. The virus has affected a total of 125 countries, recording more than 31 crore cases and 53.5 lakh deaths, and still continues to keep the world on its toes with new mutations. Not yet coped up from highly communicable Omicron, a new COVID variant is identified by China named Neocov, a more deadly variant with very high mortality rate. The pandemic has set forth an array of challenges before us: medical, ethical, social, and organizational. COVID-19 has not only immensely impacted the global economy, bringing it down to its knees, but also greatly affected the psychology of the people. Owing to increased risk of infection, uncertainties, insecurities might tussle with self-preservation and protection of loved ones, increased the levels of stress, anxiety, fear, frustration, etc. among the people. Evident from the graphs, the symptoms of anxiety and depression have increased in adults from 11 to 41.1%. 53.1% are emotionally exhausted, and likewise many more mental health symptoms are seen increasing with the increasing COVID mutation scare and cases. These all led to an outburst of emotions as a reaction, and people reacted to current situation in a drastic way, leading to a phenomenon known as the Great Resignation. The Great Resignation, or Big Quit, is a phenomenon that started off in the USA in 2021 and describes record numbers of people leaving their jobs during the COVID-19 pandemic. In the last 2 years, the workplace worker dynamic has seismically shifted. No longer are jobs a means to an end. Employees need to feel motivated at work and be able to find meaning in the work they are doing. As a result, workers are increasingly expecting their employers to provide benefits, allowances, and flexibility conducive to a work-life balance that pre-pandemic may have seemed unattainable. And if companies don't meet their needs, they will take their labor elsewhere. A survey by the Society of Human Resource Management found that 40% of the workforce is ready to quit and 53% are feeling tired or burned out. Moreover, 30% report struggling to get the necessary work done, 27% feel less loyal to the organization, and 55% now question whether their pay is high enough. Almost all the industries are facing its impact. Living through and surviving the pandemic lockdowns nudged many to see work-free living as a viable option. These all impacted the psychology of the people greatly, and they are willing to leave their jobs instead of continuing it, leading to the trend of Great Resignation. A similar trend could also be traced in India, especially in the IT sector. And the reasons for Great Resignation or Great Talent Migration in India do not differ much from the world. Apart from economic reasons, reeling under the pandemic stress, absence of one-on-one physical interactions, lack of a sense of belonging to their workplace, decreased optimism about their future in organizations because of the prevalent uncertainty and negativity, nudged employees to think deeply about what kind of work-life balance they want, and if switching to other organizations would improve their current state. Many of them may have simply quit because they had reached a breaking point because of increased workloads during the months of lockdowns and other pressures, forcing them to reassess their work and life goals. As a result, the attrition rate rose to 15.3% in TCS, 25.5% in Infosys, 22.7% in Wipro, and 19.8% in HCL. So now, to understand the reasons and solutions to such outbursts, let us move on to our Q&A section with experts, where today we have two honorable experts with us. The first speaker is Dr. Ravi Gajendran, an Alva Chapman eminent scholar, and the second speaker is our very own faculty member, Dr. Alpana Vaidya, the initiator of MNB Manobal, an online platform for providing an online psychosocial support. What are your opinions on the Great Resignation, and why do you think COVID played a catalyst in triggering the phenomena?
So the Great Resignation, at least in the United States, is a result of a number of factors. The first one is, for a long time, the demand-supply dynamics favored employers. So there were fewer jobs. I mean, there were fewer jobs than people looking for jobs. Now it's the opposite. Now there are lots of jobs, but not as many employees. So as a result, you are seeing a shift in people moving from one job to another. Now, why is it happening now, and how did COVID play a role? So the part of it is because once COVID, once the pandemic started, people were kind of worried about what's going to happen to their job, whether if they quit their job, whether they left and they went to some other organization. They were not very certain that that would be a good idea. They expected that the pandemic would maybe kill the economy, there would be fewer jobs available. So people were more reluctant to move. Secondly, it also made the whole process of recruiting, selection a little bit harder. People needed to figure out, how do you recruit in a pandemic? So employees might have been hesitant to travel to different locations to interview and so on. Employers may also have been trying to figure out, how do we do recruitment and selection? So a lot of that process maybe got sort of stalled. So many people who wanted to quit in the immediate aftermath of the pandemic for various reasons chose to just stick around, to just wait and watch to see what's going to happen. So you had a lot of postponed resignation, so to speak. And so now when things are easing up and people have got vaccinated and travel is opening up, and the pandemic is at least people are learning how to manage with the pandemic. More people are now willing to leave their jobs, and look for newer opportunities. So what the pandemic did was, for a brief point of time, freeze everything in place. Apart from that, a lot of people also lost jobs. So initially, when the pandemic struck, especially in front-facing jobs and in the service sector, a lot of people lost jobs. So it created some uncertainty that might have prevented some people from quitting when they wanted to. So it postponed their decision to leave. And once things opened up, a whole bunch of people just decided to leave. So those are so that's some part of how COVID played a catalyst. Another way in which COVID played a catalyst was the whole idea of remote work. Because everybody shifted to remote work in the aftermath of the pandemic. Not everybody, but a large proportion of, especially knowledge workers, started working from home. So as a result, a lot of people found that they could be productive at home. They started questioning why they should be commuting, right? Why should they commute 1 hour or 45 minutes every day to work, and in the pollution and the traffic and so on. And so they came to the conclusion that I can work from home. And so they started looking for opportunities which would allow them to continue working from home even as the pandemic sort of subsides. Even as employers are calling back people into work, people are saying, I don't want to go back into work. The pandemic is still not over. I would prefer working from home, especially for working parents, single moms, etc., who have to deal with childcare issues and who worry about their own health and safety. They would much rather continue working from home. And in those situations, if your employer is not as flexible, people say, okay, wait a minute, I'm going to look for other jobs where I can be full-time remote and still get my job done. So in that sense, COVID is another reason why we are seeing some of these adjustments in the labor market, where people are moving to jobs which suit their preferences a little bit more. The third reason is many people may have wanted to quit their jobs. Maybe they were disengaged, unhappy in the jobs even before the pandemic, but they were not finding good opportunities. Now, because the situation has changed and, employers are, many employers are now looking for employees. People are now moving from, toxic bosses, toxic work environments, from less satisfying jobs to more satisfying jobs. So people are trying to figure out, readjust, especially now that they have the opportunity to take more risks and the opportunity to find more, options for themselves. People are going ahead and doing that. So that's also part of the whole, Great Resignation process. Finally, another thing that happened during the pandemic is, a lot of us, confronted the possibility of our own mortality. We are all worried about, whether, we'd be afflicted with COVID, whether we'd die, etc. And that got a lot of people questioning, what am I doing? I mean, why am I, struggling for this job, if I could be dead tomorrow? So a lot of people reevaluated, their choices. They started looking for meaning and purpose in their lives. And that translated to looking for meaning and purpose in their own jobs. And as a result, some of this Great Resignation is perhaps people looking for jobs that are more in tune with their own preferences. So these are all some of the factors. And finally, a lot of people who lost their jobs during COVID and were sitting at home, what they did? They started going on to Coursera or other websites, and retraining themselves. They started taking courses and started finding jobs in other places. So people who were maybe servers in a restaurant, or people who were, driving Ubers, and they decided that it was too dangerous to do all this. And so, or maybe they lost their jobs and didn't have the opportunity to continue in that same occupation. They started looking for other opportunities. Maybe some of them became, beauticians. They took some other course online, and then they changed their occupation. So, in that sense, COVID also got people, because they were forced to leave. They didn't have jobs. They were forced to, be unemployed. Many of them rethought, what they wanted to do. Maybe they retrained themselves in some way, and as a result, look for different jobs. And so that's also part of this entire story. So it's really a complex story as to, what happened during the Great Resignation and why and how COVID played a role, the pandemic played a role in this.
Great Resignation started off in the USA, but can be observed in India as well. However, Indian employees do not have access to many of the unemployment allowances and concessions available to those in the USA. What, in your opinion, have motivated the Indian employees, especially those in the IT sector, to leave their jobs despite the expected future challenges such as financial instability?
So I think when people resign, it doesn't mean they're going to sit at home being unemployed. Most people have a plan, and usually the plan is to find another job. And so even in India, when people are quitting, they're doing so with some kind of a plan in mind. So they're doing so to either join another organization, maybe start something of their own, or just take a break. For many, I know of people who just decided to, take a year's break because they feel confident in their skills, they feel confident in their abilities, that, they take a break, maybe do like they do a course. Many people are doing courses in data analytics, for example, in their break, so that they can retool their skills and get back into the workforce. So the Great Resignation doesn't mean, unemployment. It does not mean that people are quitting without a plan. People are quitting with some kind of a plan in mind. So most of them are likely to be finding better opportunities. So they may be finding opportunities which allows them to work from home. So one of the things I'm hearing is a lot of employees now are shifting back to their original home. So people who came to Bangalore or Hyderabad to work for IT companies from Calcutta or from a tier 2 or a tier 3 city, instead of paying, high rents in Hyderabad or Bangalore, they're going back to their town, staying with their parents, but still continuing with their same jobs. Or they're shifting to jobs which allows them to work from wherever they are from, whether it's Ranchi or Allahabad or Calcutta. They go back there, they're working from there for companies which are located in Bangalore and Hyderabad. Previously, they would have had to locate to these cities. Now they can stay where they are and still work. So part of the Great Resignation is people moving to opportunities that are more in line with their preferences and their pocketbooks.
Adding to the previous question, one of the biggest common reasons for attrition turns out to be burnout. What, in your opinion, could be the possible psychological reasons for the burnout and dissatisfaction in employees in India?
Psychological reasons for burnout and dissatisfaction among employees in India could be people subjected to prolonged stress, feeling of anxiety as a result of emotional uncertainty of COVID-19 pandemic, people not finding time for physical and psychological recuperation, trauma caused due to death of near and dear one, difficulty in maintaining work-life balance, emotional exhaustion due to work and family pressures, thereby leading to feeling of physical and psychological fatigue. In addition to this, job demands, long hours of work, lack of control, lack of autonomy, deadlines, and job pressures. They are responsible for burnout as well as dissatisfaction among the employees.
So, what, in your opinion, could be done at individual and organizational level in the USA and India to maintain and promote a healthy work environment, incorporating the new psychological needs of the workforce, preventing the phenomenon like Great Resignation taking place in the future?
So burnout is indeed a big problem. I mean, especially in the healthcare sector and allied sectors. You have burnout is severe in the sense that people are overworked, they're stressed out, they're worried about their own health, and they often have to work in conditions that are unsafe. So especially in that sector, people are feeling burned out. But in a lot of other occupations as well, people are feeling sort of overworked, overwhelmed, and stressed out. Now, in that context, is Great Resignation actually, one of the triggers for people leaving jobs is because they are overwhelmed, they're stressed out, etc. And one way to address burnout is to just quit the job that's burning out and move to another place, right? So to move to a place that gives you more peace of mind, that gives you a job that is more manageable. So if you think about burnout, there are really three factors that affect burnout. One is you feel exhausted. The second is you feel detached from your work, you feel cynical about your work, you just don't care about your work. And the third is you don't feel like you can do your job as well. You feel like you don't have the confidence or the skills required to do your job. And oftentimes, burnout has to be addressed both at an individual level and at an organizational level. So in terms of exhaustion, people need to learn to take a break, especially if you're working remotely. You don't have start and stop times. You don't have those regular, I'm driving to office, I'm putting on my office hat, I'm driving back home, I'm taking that off and putting on my family hat. You don't have those regular markers, and people are working all the time, late night, early in the morning, and so on. So they're exhausted, and often we don't have opportunities to go outside and exercise or relax or meditate. So the first step towards dealing with burnout is self-care, right? Giving yourself the opportunity to exercise, eat well, sleep well. I mean, that's a big deal. Sleeping well, affects your energy through the day. But also self-care in the form of maybe some kind of meditation or prayer or something that rejuvenates you from the inside. So that addresses the exhaustion part, right? But you still have things like you're feeling, that you're feeling like detached from work, that you don't care about your job anymore. You have no motivation to do the job, and you're still kind of just, going away with it, going along with it. And part of it is because maybe you have too much to do. Maybe, there is a lot of work and you don't have support, or there's a lot of office politics, or your ideas are not being heard, or you have a bad boss or a toxic, coworkers. So all that, it's not something that you can solve very easily. You can maybe solve parts of it. Maybe you can say some part of your job you don't like. You can say you can delegate it to somebody else if you have the luxury of doing that. but not those things are at the organizational level, right? So the organization needs to figure out that you're overwhelmed, you're stressed out, you're burnt out, and needs to solve for that. And often this is not an easy thing to solve unless the organization sees, hundreds of people leaving. They're not going to get their act together and do something about it. So at the organizational level, recognizing when employees feel, overwhelmed, exhausted, burnt out, and giving our employees the opportunity, giving them extra help, creating a more pleasant work environment, ensuring that deliverables are clear, ensuring that managers are treating their employees fairly, managers are treating their employees in a considerate manner with empathy. Those are all things that organizations can do, but those are really hard things to do, at least in the short term. So if you are an employee who's burnt out, chances are it might be easier for you to find a different role within the same organization, which is less demanding, which has a better boss, or the unit has a better, work culture, or just find another job altogether, right, where the conditions are better. The third aspect of this is, if you're feeling overwhelmed, if there's a lot of politics, conflict, there is not much support in the office, and you're feeling a lot of stress, you don't feel you can do your job very well. You don't feel good about yourself. You don't feel good about doing the job. You don't feel confident about yourself. And so again, here the solution is to just get out of the situation rather than wait for the organization to set things right. The organization will only get its act together if there's a mass exodus, right? If it's really affecting its performance, that's when it's going to say, okay, let's do something at an organizational level. And at the organizational level, making sure that employees are being treated fairly, making sure that employees are being treated with empathy, making sure that caring for people is a priority for the organization, and the organization rewards its managers for treating its employees well. Those are some of the things that organizations can do to minimize burnout. The other thing organizations need to do is to actually recognize that there's only 24 hours in the day for every employee, and not overburden or over stress them out, and have sort of regular surveys, have sort of regular check-ins with employees to make sure that employees are not feeling burned out. So that's something you can do at the organizational level.
What needs to be done to promote emotional as well as mental well-being at workplace? I would suggest that efforts need to be done at the individual level and also at the organizational level. At individual level, evidence-based interventions like mindfulness, self-awareness exercise, appreciative interviews, mindfulness-based stress reduction, cognitive behavior therapy is found to be very, very effective in promoting mental health. It is also essential to go to the counselor and take his help whenever individual is experiencing problems related to his family life as well as related to the workplace issues. In view of mind and body connection, it is necessary to maintain proper diet, nutrition, exercise, yoga. All these things are useful in promoting physical health and thereby mental health. At organizational level, it is necessary for the organization to appoint a counselor and psychiatric social worker. This will help the employers to go to them whenever they want to discuss about their personal as well as work-related issues. In addition to this, companies can regularly undertake stress management, CBT, MBSR, time management, and the like programs to promote physical as well as to promote mental health. Employees should also get the sense of confidence and trust, and this is possible only and only when there is flexibility and autonomy. There should not be fear among the employees, and that atmosphere should be promoted by the organization. In addition to all these things, I feel that safety measures need to be in place. Flexi time, sense of autonomy and control, psychosocial support, economic support. All these factors will contribute to mental health and well-being, and they will help the employees to reduce stresses and strains and thereby They will promote performance, productivity, and efficiency at workplace. Thank you.
Lastly, a huge number of population has been working from home for the past 2 years, now being adapted to the comforts of work from home. Many of them are no longer willing to get back to the pre-COVID stressful work. Do you think the new normal will be the future?
So, in my view, I think we are going to see hybrid work as the new norm. We are going to see that most employees are looking for more flexibility than they had in their jobs before. Especially if you think in the Indian context, right? I mean, if you think about cities like Bangalore, Bombay, Hyderabad, Delhi, a lot of employees have long commutes in very unpleasant traffic. They're often stuck, for hours together sometimes on the road. And, it's very unproductive, right? And it's also very stressful. The pollution gets to them, it affects their health. So a lot of employees are now going to say, okay, look, I worked remotely during the pandemic and I got my job done. There is really no need for me to be in office 5 days a week or 6 days a week. I'm going to come in 2-3 days a week and I'm going to work from home 2-3 days a week. So that way I can take care of myself better. I don't have to be stuck in a stressful commute. I don't have to deal with as much pollution. And also, people are more productive. Sometimes you need to be away from all the politics and the interruptions and all the disruptions of office work to be alone by yourself to do some concentrated thinking. So it's actually, having a hybrid arrangement where you're, a few days in the office, few days at home every week. That would be ideal for the ideal, I believe. And so you're going to see hybrid work as the new normal. You're also going to see more flexible work hours. So even as you're working, in a hybrid fashion, you're going to see people being allowed to, start late, end late, or start early, end early, and so on. So you're going to see much more flexibility from the employer being given to employees, because employees have shown that when you give them flexibility, they actually can deliver results. They're not, shirking or, not goofing off when they're working from home.
Therefore, it wouldn't be wrong to conclude that even though money plays a central role in economic decision making of the people, it is not the only determinant impacting decisions, and hence, it is time for employers and organizations to shift from offering just monetary incentives to prioritizing a healthy work environment for the retention of satisfied employees.
The COVID-19